For weeks now, we have been asking local hospitals to show us how they're preparing if a patient tests positive for Ebola here.
And today, Seton gave us access to their emergency room, which is where they would quarantine a patient. KXAN's Erin Cargile live to show us what she learned today.
Robert and Shannon, isolating the patient is key, but I learned today it's not as dramatic as you might think. Seton would actually take more extreme measures with a patient who has H1N1 or tuberculosis because those are airborne illnesses.
Dr. Chris Zabel, head of the ER at UMC Brackenridge, walks us through what would happen if a patient who walks through the doors is showing symptoms of Ebola.
We'd have you in a mask so that you can't cough secretions out of you.
He says there would be no need to move them to a special isolation room used for airborne diseases. This regular room in the ER would work just fine, but the door would be closed and staff would suit up.
This is a gown that it's paper, but it's impervious, and it's got little sleeves. Head goes through there, sleeves go through there, and now I've got a full barrier protection on the front, and then a mask with an eye shield. So that goes on and fits there, and then my gloves.
Dr. Zabel would likely cover his shoes as well. He says covering up every inch of skin from head to toe, like we've seen in recent news coverage, is overkill.
Even getting Ebola, a drop of Ebola blood on your skin isn't likely to do anything unless you have chapped skin, dry skin, a crack in the skin.
Every time they leave the room,
And the whole thing gets balled up and thrown away.
And as a direct result of the Ebola case in Dallas, Seton has rolled out a brand new policy in all of their hospitals. Nurses are now required to ask every single ER patient, no matter what symptoms they are showing, have you traveled anywhere recently? If so, where? Live in downtown Austin tonight, Erin Cargile, KXAN News.
Coming up at 6 o'clock here on KXAN, we'll take a look at how local paramedics are going over procedures for treating and transporting patients with Ebola symptoms. Our coverage of the Ebola case continues online at KXAN.com. You will find a timeline of the virus's progression since 1976 and information you may not have known about 2 previous incidents of Ebola here in Texas.